Queen's University Belfast and King's College London are working with the mental health and wellbeing charity Inspire to provide and test the acceptability and effectiveness of two different treatments for post-traumatic stress disorder, or PTSD, in veterans in Northern Ireland. This is called the PETT project. The symptoms of PTSD can be experienced by military veterans and can negatively impact on their day-to-day activities, functioning and relationships. In Northern Ireland, this is complicated further because of the Troubles, which means some veterans who served in Northern Ireland still reside within or close to the communities they patrolled and may well continue to fear for their security. This can make it difficult for them to seek help and talk about their experiences, oftentimes leading them to feeling misunderstood and socially isolated. We know that many veterans in Northern Ireland experience symptoms of PTSD, but we don't know the exact number. One of the recommended treatments for PTSD in veterans who have been involved in combat or counter-terrorism is a talking therapy called trauma-focused cognitive behavioural therapy, which normally involves between 8 and 12 therapy sessions. Unfortunately, one version of TFCBT, called prolonged exposure, may lead to high dropout rates, and a proportion of patients retain symptoms of PTSD. Our team believe, therefore, that there is a need for improved treatment approaches for PTSD symptoms in veterans. The PETT project will test two forms of treatment for PTSD which do not involve prolonged exposure. One is called Neuro-Linguistic Programming, or NLP, which has shown promise and is being rolled out in the veteran community in the USA. And this will be compared to a more recent model of TFCBT, which does not involve prolonged exposure. The PETT research team hope that both of these treatments, which avoid prolonged exposure to the trauma, may be more tolerable. The reason for the PETT trial is that currently we do not know how effective these two forms of treatment are compared to each other. This study therefore wants to test the NLP PTSD treatment, which is called Reconsolidation of Traumatic Memories, or RTM. Early studies have shown RTM to have good results as a treatment for veterans. 4 small studies from the USA have shown promising results with fewer treatment sessions. To test whether RTM is an acceptable and effective treatment, we will work with experienced therapists from Inspire, training them to deliver 2 treatment approaches. One will be a recent model of trauma-focused CBT, which avoids prolonged exposure, and the second will be the new RTM treatment. We will recruit 60 veterans who report PTSD. People will be randomly split into 2 groups, therefore 30 of these people will be provided with the RTM treatment and 30 will be provided with the trauma-focused CBT treatment. All treatments will be free of charge, and we will carefully monitor how people are responding and record whether people are improving as a result of the treatments and staying safe. If you are a loved one or a veteran currently based in Northern Ireland and think you might be suffering from PTSD, please get in touch with the PETT study team by emailing pett@kcl.ac.uk or calling us on 020 7848 3620.